face tent goes on the other end. Right here. You have a lot of tubing, and it seems like a lot. But when you're hooking this up on a patient, you want your drainage bag to be down. So gravity pulls all that moisture straight down. You don't want to connect this. You have a little loop on your drainage bag. Have you got it? Everybody see that little loop? Okay. You can use that to hook it to the bed. It's not recommended that you connect it to a bed rail, because what happens? People push the bed rail down and then the mask gets pulled off the face. Okay. So hook your drainage bag somewhere down at the base of the bed. Okay. Then you have enough tubing to come up and go on your patient. Face tents.
Sometimes what you have to, when we say it, you want it to come downhill almost in a straight line. So if it comes from the flow meter in the wall, it should come down to the bed frame and then back up to the patient. If you take the bed frame and you still got so much tubing that it goes down and hits the floor and then comes up to the bed frame, it's too much tubing. You will need to trim it back some so it doesn't have an extra loop that is lower than the drainage bag. That's the key. If there's an extra loop that's lower than the drainage bag, that's where all the accumulation of excessive droplets will go. And then it literally plugs up your tubing and no gas gets through anymore.
All right, face tents. There is a proper and an improper way of putting them on the patient's face. Every face tent has a nice little groove here that's for your chin. Okay. If you notice, when I put this on my chin, where is the oxygen blowing? Straight to my nose. If I do this, where is it blowing? To my chin.
Below your mouth.
To my chin and then my neck. Okay. So you want it to be set up so that the oxygen is blowing straight to the nose. Okay. There's nothing more frustrating than to go in and see where a respiratory therapist just put this on upside down. Okay. When do we use this on patients? When do we use this kind of therapy on patients?
You mean like mask?
What type of patients would we use this on? What situations?
Are vomit on themselves?
They haven't,
Okay.
haven't covered
Or
that
not
yet.
face that, never mind.
Pediatric, I haven't actually covered that.
Well, let's think about it. Okay.
We haven't
Well, let's think about it. It's a cool mist.
So ones that cannot humidify?
Okay, somebody who needs a whole lot of extra moisture.
Okay.
Maybe somebody who is severely dehydrated. Okay. How about somebody who's had surgery? What do we do when we have surgery? We put in a big tube down their throat, give them anesthesia. We pull that tube. Cool mist. Cool mist helps reduce swelling. Okay. How about that patient that was possibly involved in a house fire? Smoke inhalation, smoke and heat inhalation. Can we give them this?
Sure.
Okay. Helps reduce the swelling. Okay. When you have a tracheostomy tube, that is a tube that goes straight into your trachea right here at your neck. Are they getting the normal humidification?
No.
Where do we get our humidification from normally? The nose. We're bypassing the nose and the mouth. So we have to humidify that gas, okay, that's going into their trach. So we can do it with aerosol. Okay. So this is how your trach collar works. It's going to go over the trach tube and around the neck. Now you have this nice little snap here. sure it's nice and snug, but not too tight. And it goes right over top of that trach.
Now, I want you to notice when you look at the trach collar, there is a upside and a downside because its contours are different.
To make it like smiling.
There's a. and
Make
you
it
need-
where it's smiling, that's a good idea, because if you're doing this,
It's
but
upside down.
yeah, and it's gonna flop this way. And where's the oxygen going? Back out into the air.
Yeah.
You need to make, you're gonna go to the hospital next to Sylvester and you're gonna walk into the room and find somebody put it in upside down. There's a thing called, a belief that if it can't happen, it will happen. So eventually somebody's gonna do it wrong. So just pay attention to that. Okay. What I'd like for you to do